My name is Mackenzie. I'm a business person who does cleaning services, and I just want to give you a story of the issues that I've had with my leg. I actually had this problem like for the last 10 years. I had the first diagnosis was arthritis. I saw one doctor for about 5 years, and then I went to, there was no change. In fact, it was getting worse. I went to another rheumatologist. When I saw this other rheumatologist, he told me from the diagnosis and the test that he's done, I don't have an issue of arthritis. And my knee was getting actually worse. So, and the pain was getting worse. Now it got to a level whereby I could not even walk. I could not do anything for myself. And being a person who is self-employed, a person who actually has to stand, has to walk all the time, because that is the nature of my work, it was such a challenge, because it got to a level whereby I could not even leave the house. I could not do anything for myself. I literally had to rely on people. So one of my daughters referred me to some doctors around the area of Aga Khan Hospital that normally come from India, who are actually bone specialists. That is the word that she used. So I went to see these doctors, and I got a different diagnosis. I decided, let me check out with another doctor. I went to this other doctor. The diagnosis was almost similar from these Indian doctors. And then I ended up having an arthroscopy. That was in the year 2021 in May, during the COVID period. So I had my arthroscopy, the first one, and I followed the due process, that is physiotherapy and everything. And I never actually did anything for myself. Since 2021, in May after my surgery, until this year, 2023, when somebody came to my house, and he's actually a nurse, and he asked me what my problem was, because he could see I was really struggling with walking. I could not do anything for myself. I had kind of a stoop when I was walking. You know, you kind of find a way whereby you adjust your body so that at least you can do something for yourself. But I was not leaving the house. Basically, I would just leave the house and go for physiotherapy and back to the house. And I used to have a lot of pain. I had a lot of pain actually, because my local clinic whereby you could actually go for first aid, they kind of got used to me, because I would go there, I was in a lot of pain, so they basically give me painkillers. I didn't know in Kenya that we had pain specialists, so I was referred to one who I saw, and they continue, of course, giving me painkillers, but the pain was not going away. So when this gentleman came to my house and told me, why don't you try Dr. Adari? That was in December 2022. Of course, it was Christmas season, the festive season, so I had to wait until, I think I called the doctor sometimes end of January or beginning of February. I can't remember the days very well. So he referred me. I came to the clinic. My daughter brought me here, and I was in a lot of pain. Actually, when I walked in, because of the pain that I had, I was put on a wheelchair. So the doctor looked at me. Of course, you know, after seeing so many doctors for so long, you have a lot of, you know, information, you have a lot of MRI tests, you have a lot of reports from the doctors. So basically, you kind of work with them. Some of them are on email, some of them you have them physically. So when I came to see Dr. Adari, that I can remember very well, it was on a Tuesday, and I was in a lot of pain. So he referred me for admission. So I went for admission. So when I went for admission, I went through the necessary tests, the MRI and everything. And then day of surgery came. So I went through surgery, and after surgery, I was taken back to the ward. So basically, I just waited for pain. Because I had been in pain for so long, I waited for the pain to come back. And I kept telling myself as I was in the ward, is that basically I'm not in pain because probably they've pumped me with a lot of painkillers because I'd gone in for surgery. That was arthroscopy. This was the second arthroscopy that was being done. So I kept waiting for the pain. I kept waiting for the pain. I kept waiting for the pain until the day I was discharged. I waited for the pain. I was put on when I was discharged from hospital, I was put on the 2 crutches, the auxiliary crutches that really assisted me. And I think I'll be very honest, in I think 2 weeks after my surgery, because the doctor told me I should not put my leg down for about 6 weeks. But of course, when the pain is not there anymore and I had something to do, I left the house after 2 weeks. Of course, I kind of, balanced the crutches because it's not so easy. But since that period, I've been able to do a lot of things on my own. I'm back on my feet. The pain has never gone. I just come back for follow-up clinic. In fact, the last time I saw Dr. Adari, that was I think like 4 months ago. Because you've seen doctors for so long, you kind of don't want to see doctors anymore. Because every time you see doctors, it's just medicine, pain. You kind of get tired of seeing doctors. So I can say there's a very huge difference in my life right now. I'm back on my feet, and very soon I'll have gained full strength on my leg that had an issue, not forgetting that I didn't walk like for 2 years. I didn't use that leg for 2 years. Of course, the leg is weak, but of course, I'm in the process of having the leg strengthened. So I believe I'm in the right place. And I highly recommend Dr. Adari to anybody who has leg issues. And the people who knew what I was going through have really, really seen the difference in my life now. And I can feel my life is better. I'm independent. I don't have to rely on people all the time to do things for me. And I think I'm on the journey to full recovery and full usage of my leg. Thank you.